Welcome to Spotlight. Joining us are Nick Johnson, Director, State Fiscal Project, Center on Budget and Policy Priorities. Elaine Mejia, Director, North Carolina Budget and Tax Center. And Noah Berger, Executive Director, Massachusetts Budget and Policy Center. There are many issues impacting state budgets in the light of the recession. However, Nick, some economic indicators have been looking pretty good lately, like stock prices and corporate profits are looking up. How are low-income families faring?
Well, it does seem like perhaps we're in the beginning stages of what may be a recovery, probably a long, slow, gradual recovery. But unemployment is still very high, projected to stay high into the next year. And as a result, poverty is very likely quite high as well.
Elaine, what types of policy changes could be made to ensure that all workers and their families share in any economic recovery that we're having?
Well, I think as Nick mentioned, we're still certainly in this period. Hopefully there's a beginning of a recovery, but in this period where we need to make sure that all of the programs and the opportunities for assistance are really there. So bolstering them. And I think for the most part, federal and state governments have been trying to do that. Programs like continued unemployment insurance, looking at extending that, making sure families have access to food and nutrition assistance, which is a program that's grown tremendously, So continuing access to those, and then thinking about, how do we want to structure our economy going forward so that everybody can participate in the recovery? Is this a time when we need to be thinking about bolstering the minimum wage as we begin to grow jobs again so that families are not in the position in the next time we have an economic downturn that they were in now, where wages really had not been growing even during an economic expansion period for low-income working families. So we don't want to be in that position again. So lawmakers, unfortunately, I know are very busy, but it's important to think about the short term, the things that are really needed right now, and also to begin, building systems that can allow everybody to share in the prosperity and the growth when it really begins in earnest.
Noah, lawmakers in the state of Massachusetts, your state, and North Carolina made the tough decision to raise taxes during the recession. What was their rationale for doing that?
Yeah, I think clearly a recession is a very difficult time for state governments because two things happen at exactly the same time. One is you have less revenue because as people lose their jobs and businesses make less money, they pay less in taxes. And at the very same time, the needs grow. More people, when they become unemployed, rely on Medicaid. More people become homeless and need homeless services. And it puts states in that difficult position of having to make very hard choices. Either you're going to raise revenue somewhat or cut services when they're needed most. And both of our states did a sort of balanced approach of some of each, where there were some fairly difficult and painful budget cuts, but also additional revenue. And I think part of it was the kind of sort of looking to the long term that Elaine mentioned, that if in a recession you cut back on those things that will be essential for long-term economic growth and to help people prosper in the years ahead, that's the worst thing you can do. A lot of people are going back to school now when they can't get a job. If people can go to community colleges and get good skills, that means as the economy begins to recover, they will be able to get the kinds of jobs that will allow them to support a family. The worst thing you could do in these times is to take away all of those opportunities and say to people, all you can do is sit home and do nothing and just be unemployed for a couple of years and watch your skills deteriorate. Even longer term, basic public education. I mean, in the long term, to help abolish poverty, one of the things we need to make sure is that kids growing up in poor families, in poor neighborhoods, get good basic public education so that they can go on to at least a community college and get the kind of skills that can move them into the middle class. So I think a lot of it was making sure that we can protect those investments that are really what will allow us to help people get out of poverty as the recovery begins, rather than just making cuts that, frankly, for low-income people would mean the recession would never end, that they'd never have the skills and supports that they need to get out of poverty and begin to really participate fully in the economy.
Mm-hmm. Elaine, how did you see that additional revenue from the increased taxes affect low-income families in your state?
Well, very directly, and in many ways the way Noah just described. It certainly allowed us to maintain sort of those short-term assistance things that people are finding themselves, even working families, needing to tap into. Things like Children's Health Insurance Program in North Carolina. If we hadn't been able to raise some revenues, we would have put a freeze on enrollment in that program. and this is low-income families in North Carolina who are able to participate in this program that provides health insurance to their children. And we would have told all the families who would be technically qualifying based on their income levels now for that program that they couldn't enroll. And those kids would be going without health insurance. And we made a decision in North Carolina that wasn't in our short-term interest or our long-term interest, as Noah described. We really rallied in North Carolina around the value that our public systems have for us in the long term as well. And there was really a widespread concern that we would actually harm our economy if we were to cut back on the quality of our higher education system or our public schools or even our early childhood programs. And we, for the most part, didn't make deep cuts to those things. There were certainly areas that were hard hit and where we're talking about how can we restore some of the cuts that happened, because now that we're seeing them in place, there's growing concern about them. One area where we really made deeper cuts in North Carolina than in many other places was in our mental health system. And that's really, you can see the stories begin to pop up in communities about people needing access to basic mental health services. And those were never services that were easily accessed anyway. And now we're really in a state of emergency. So that's an upcoming discussion we'll be having. But we filled in about a quarter of our state's budget gap in North Carolina with additional revenues. And when I'm going around the state talking to state lawmakers and others, everybody's saying we don't know what we would have done. I mean, we can't even imagine what kind of devastation we would have had to all these public institutions and structures that we value if we'd had to balance the budget with cuts alone.
But Nick, not every state is going to increase taxes. So what are some other states doing to make ends meet, to keep these programs running?
Oh yeah, actually a very large number of states have raised taxes, and I expect more will look at doing so in the coming year in order to mitigate the extent of the cuts they're passing. Every state is cutting its budget. Every state is cutting education and healthcare and transportation. At some point, I think lawmakers feel like the cuts just can't go any further. States are required by law to balance their budgets. Most of them have drawn down their rainy day funds, used up most of the reserves that are available. There really are only two solutions left: cutting spending and raising revenues, and most of them are doing a combination of those two. About 30 states this year did some sort of revenue raise or tax increase.
Oh, sorry. Go
ahead,
Noah.
The one other piece which has helped both in the states that have raised taxes and those that haven't has been federal fiscal relief. So in Massachusetts, we had about a $5 billion budget gap, and about a third of that was closed using money that the federal government provided to help the states. And I think that's an absolutely critical part, that states are forced to balance their budgets. So they have that impossible choice that at exactly the time when revenues are dropping, the demand for services is rising. And the states can't do, honestly, what the federal government can do, which is to deficit spend in a recession. And when the federal government does that, it has two effects. One is it helps to stop the national recession. That is, we're at a point where demand was just dropping dramatically. And one of the most effective ways that the government can intervene to restore demand in the economy and put people back to work is to give money to state governments who need to spend that immediately to protect access to health care, to protect teachers so that kids have teachers in their classrooms when they show up for school. So from a sort of macroeconomic perspective, the federal government providing that money to states was very important. But for the states, even those that raised taxes couldn't have survived without the federal assistance. I mean, every state would have had to make much deeper cuts to the point where we would have seen a lot of people going without access to really basic things like the ability to go to a hospital when you need to. Schools would have had a dramatic impact in terms of the quality of education that kids get. And kids are only in school once. And if you have a 3 or 4 year recession where schools are devastated, that's going to have an effect on those kids for the rest of their lives. And the federal money allowed states to sort of get through at least the first year without making as brutal level of cuts as they would have. Unfortunately, some of that money is running out now before the fiscal crisis has ended. So I think one of the big challenges is to make sure that that fiscal relief doesn't end right when it's still in the middle of being needed the most.